Good morning, class. Today we are going to look at the uveitis. So uveitis is among the conditions that affects the eye. So uveitis is broadly defined as inflammation of the uvea. The uvea consists of the middle pigmented vascular structures of the eye and includes the iris, ciliary body, and choroid. So we are saying the uvea is made up of three structures: the iris, ciliary body, and the choroid. Uveitis is basically an internal inflammation of the eye. The condition involves the middle layers of the eye, also called the uveal tract or uvea. Like I said, that uveitis is the inflammation of the uveal tract, but this uveal tract is made up of three structures: the iris, ciliary body, and the choroid. So all these are structures that make up the middle layer of the eye. The uvea is made up of three parts: the iris, which is colored part of the eye; the choroid, which is a thin membrane containing main blood vessels; and the ciliary body, the part of the eye that joins these together. So of the three parts that we've mentioned making up the uveal tract, the choroid is a thin membrane rich in blood vessels that supply the delicate structures of the eye. The ciliary and the choroid are located behind the iris. An ophthalmologist can visualize them using a special examination equipment. So for an ophthalmologist to diagnose you with the uveitis, they need to use a special equipment so that they're able to look at the back of the iris or at the back of the eye. The uvea is very important because its many veins and arteries transport blood to the parts of the eye that are critical for vision. Like I said in the beginning, that from these three parts that make up the uveal tract, we have the choroid, which is rich in blood vessels. In other words, it's highly vascularized. So these blood vessels, they transport blood to various parts of the eye so that vision can be maintained at all times. That was just the introduction. So now let us look at the definition. So uveitis is inflammation of the uvea of the eye. Inflammation of the ciliary body is called the intermediate uveitis or cyclitis. You have to pay much attention to this. We've already defined the inflammation of the we've already given the definition of uveitis, which we say the inflammation of the uveal tract. Then the inflammation of the ciliary body, which holds the three structures that we described already, is called the intermediate uveitis or cyclitis Then inflammation of the choroid is called choroiditis. Inflammation of the choroid is called choroiditis. When the choroid is undergoing inflammation, you term it as a choroiditis. Inflammation of all three is called the panuveitis. So this panuveitis simply means that there is inflammation of the iris, inflammation of the ciliary body, as well as the choroid. So we are describing, say, when all these structures which make up the middle layer of the eye, they undergo inflammation, the best term to use is panuveitis. Let us look at the epidemiology. Uveitis affects approximately 1 in 4,500 people and is most common between the ages of 20 to 60, with men and women affected equally. So you can see that uveitis is not common In 4,500, you may have one person who is infected with the uveitis. If we look at the gender category, it is affecting both men and women ranging from the age of 20 to 60. We are not saying that it is more prevalent in men or it is more prevalent in women, but it is equal in all the genders. In the West, uh, anterior uveitis accounts for between 50 and 90% of uveitis cases, while in Asia countries, the proportion drops to between 28% and 50%. So we are talking of Western countries and the Asian countries, that is Europe. So in the Western world, we're seeing that uveitis counts about 50 to 90%. That is uveitis affecting the anterior chamber of the eye. Then in the Asian of the Europe, we're seeing that the percentage drops between 28% and 50%. Uveitis is estimated to be responsible for approximately 10% of the blindness worldwide. So of all the cases that contribute to blindness in the world, uveitis contributes about 10% of those. Now let us look at the causes of uveitis. Uveitis has many potential causes, including infections with a virus, fungus, bacteria, parasites, inflammatory diseases affecting other parts of the body, or injury to the eye. So when you look at the causes of uveitis, they are quite broad. They range from parasites, microorganisms, up to as far as even systemic or other conditions affecting the body, up to the actual injury to the eye. Uveitis may be an immune response to fight an infection inside the eye, e.g. anterior uveitis is often associated with the presence of HLA, the presence of HLA. So in other ways, we're saying uveitis at times may come as a way of responding to an infection that is inside the eye. In most cases, anterior uveitis is associated with the HLA. So at times it's not advisable that when someone has uveitis, you end up giving medication, because when you end up giving medication, you are stopping the fight, because that fight is coming more like the body wants to protect the harmful microorganism which can destroy the eye. Systemic diseases as causes of uveitis. Systemic diseases. Acute anterior uveitis can be associated with ocular inflammatory alone or in association with systemic diseases such as syphilis, tuberculosis infections, or inflammatory bowel diseases. Like we mentioned, among the causes, in systemic diseases, infection can be elsewhere in the body, but it will be carried through blood and reaches the eye and affect one of the layers of the middle ear, one of the layers of the middle eye. We also have intraocular foreign bodies, foreign bodies. So any foreign body that can enter the eye can injure the middle layer, causing uveitis. We also have retinal detachment. Retinal detachment can injure or can bring damage to the middle layers of the eye. Same applies with retinoblastoma. Retinoblastoma can damage the middle layers of the eye, bringing about uveitis. Trauma to the structures involving the uvea tract. Any trauma that someone may have, especially to the eye, which goes as far as the middle layer, it may injure the uvea tract or the middle structures. Other types of uveitis, the cause is idiopathic. So we were focusing on the arterial uveitis, and so on the arterial uveitis, we've mentioned a number of things. Look at the causes: systemic diseases, retinal detachment, retinoblastoma, trauma to the middle layers of the eye, intraocular foreign bodies. All these, we can describe them under anterior uveitis. Then we're saying other forms of uveitis which are not part of anterior uveitis. Their causes are not yet known. They are idiopathic. Now let us look at the classifications of uveitis. Uveitis may be classified anatomically into anterior, intermediate, posterior, and panuveitic forms, based on which part of the eye is primarily affected by the inflammation. So under classification, we're saying uveitis may be classified anatomically, that is anterior or intermediate or posterior. Then it may also be described or classified according to the layers that have been affected. Like in the beginning, where we explained, say, if the three layers of the eye, the iris, the cerebral body, and the choroid, they've been damaged, the classification can be panuveitic forms of uveitis. So that's what we mean by classification. Let us look at anterior uveitis or iridocyclitis. So the other name for anterior uveitis is called the iridocyclitis. Is the inflammation of the iris and the anterior chamber of the eye. Iridocyclitis is the inflammation of the iris and the anterior chamber of the eye. So, like I said, according to the classifications, if you look at the anterior chamber of the eye, which undergoes inflammation, this may be classified as iris plus anterior chamber, which we've said iridocyclitis. So anywhere from 2/3 to 90% of uveitis cases are interior in location, which I also mentioned in our explanation, where I said 3/4 of the cases of uveitis, they are classified under anterior uveitis. This condition can occur as a single episode and subside with proper treatment, or may take on recurrent or chronic nature. So in uveitis, what we are saying is it may occur as a single infection where someone presents with the uveitis, gets treated, and the condition just finishes like that for good. But at times it may also keep on reoccurring, what we call cloning. A patient comes, gets treated, after 1 month or after 3 months, comes back, gets treated, after 2 months or after 3 months, patient comes back. So depending on the treatment that has been given to the patient, others they can be treated at once, and others may keep on coming until they have it treated. The second classification is intermediate uveitis. Intermediate uveitis. The other name for intermediate uveitis is pars planitis. Pars planitis. So this consists of ventritis. This consists of ventritis, inflammation cells in the vitreous cavity. So you can see that ventritis is the inflammation of the vitreous cavity. So under intermediate uveitis, it is not just the inflammation of the middle layer, but it is also involving the vitreous cavity where we find a thick uh, humous fluid at the back of the eye. So inflammation cells in the vitreous cavity or deposition of inflammatory material on the pars plana. So there is deposition of inflammatory material on the pars plana. This pars plana is among the layers of parts which are found in the eye. So when the vitreous cavity undergoes inflammation, its fluid they go as far as the pars plana, where you intend to diagnose and declassify it as intermediate uveitis or pars planitis. The third one is posterior uveitis. Posterior uveitis. The other name for posterior uveitis can be classified or can be called as chorioretinitis. Chorioretinitis. So this chorioretinitis, you can see that there are two words which are involved there. There's choroid as well as the retina. So posterior uveitis is the inflammation of the retina and the choroid. That's why the name is called the chorioretinitis, because it is involving the two structures. It is involving the two structures. The fourth classification is panuveitis, is the inflammation of all the layers of the uvea tract. I explained already earlier on. Now let us look at the pathophysiology which happens in uveitis. Onset of uveitis can broadly be described as a failure of the ocular immune system, and the disease results from inflammation and tissue destruction. So in uveitis, we are saying when there is failure of ocular immune system, when there is failure of ocular immune system, the middle layers of the eye gets to undergo inflammatory process or they get damaged. Uveitis is driven by the Th17 T cell, that they are T cell receptors. So these, the Th, they are just cells which passes through the thymus gland, bearing this surname of T cell, and they respond to receptors specific for protein found in the eye. So this T17 cell, they respond to specific proteins which are found in the eye. The T cells receptors are supposed to be deleted if ocular antigens are present in the thymus. I'm saying the T cell receptors are supposed to be deleted if ocular antigens are present in the thymus. So this is the normal pathophysiology. So if the ocular antigens are present in the thymus, the T cells are supposed to be deleted. But in these cases, the T cell receptors are often not deleted due to ocular antigen not present in the thymus. So first of all, we explained about the normal. The Th17, the thymus 17 or T cell that bear a T cell, these are receptors which respond to specific proteins found in the eye, especially in relation to the thymus gland. So we are saying antigens, when the antigens are present in the thymus gland, these T cells are supposed to be deleted. But in uveitis, you find that these T cells are not often deleted due to antigens not present in the thymus, and thus brings about the reduction in the immune system in the ocular ocular organ or in the eye. As a result, it brings about the inflammation of the middle layer of the eye, which we call it as the uveitis. In addition, the autoreactive T cells must normally be held in check by the suppressive environment produced by microglia and dendritic cells in the eye by producing large amounts of suppressive cytokines, cytokines that prevent damage to the eye by reducing inflammation and causing T cells to differentiate to inducible T regulatory cells. So this is also taking back to the first explanation that we described in relation to the immune system. So the dendritic cells in the eye are there to recognize some foreign bodies, some viruses that can bring damage to the eye. Now, if they are not able to do that, you find that there will be suppression of the immune system, which will bring about the damage to the middle layer of the eye, because they'll be able to differentiate and to induce the T regulatory cells because of absence of the T cells in the thymus gland. The T regulatory cells prevent activation and the clonal expansion of the autoreactive cells that possesses potential to cause damage to the eye. So we're saying the T cells, when they've been regulated properly, they help to prevent damage to the cells of the eye, thereby maintaining the integrity of the middle layer of the eye. Let us look at symptoms and signs. Let us look at signs and symptoms of uveitis. There is anterior uveitis. There will be inflammation of the anterior chamber of the eye. There will be redness of the eye. There'll be the first sign and symptom we say is there'll be anterior uveitis, which is inflammation of the anterior chamber of the eye due to damage to the anterior part of the eye. Then redness of the eye due to inflammatory process. Then blurred vision due to damage of the retina. Photophobia or sensitivity to the light due to damage to the retina as well. Then eye pain due to nerve involvement. Signs and symptoms of anterior uveitis. Signs and symptoms of anterior uveitis. Floaters which are dark, floating parts along the visual field. So floaters, we mean like you see some star-like fluids in the atmosphere, but when you try to look properly, there's nothing at all, and that is due to damage to the retina of the eye. Then there's also headache due to nerve involvement, which controls the eye. The signs of anterior uveitis include dilated ciliary vessels, due to dilated ciliary vessels due to inflammatory process. So it undergoes dilatation so that the ciliary body may receive much of blood to get rid of the infection which is there. Presence of cells and fry in the anterior chamber and the keratic precipitates KP on the posterior surface of the cornea. So all this is coming due to increased blood vessels of the ciliary muscles in trying to get rid of the infection which is there. Then intermediate uveitis, most common signs include floaters, which have described already, blurred visions, which have explained already. Intermediate uveitis normally affects one eye. It normally affects one eye. It doesn't affects both eyes. It doesn't affect both eyes. So it's not bilateral, but it is unilateral. Less common in the presence of pain. Less common is the presence of pain and photophobia. So in intermediate uveitis, in 3/4 of the cases, you may not find a patient presenting with pain and the photophobia. But when we say less common, we don't mean that there is no pain or there is no photophobia. It may be there, but in most cases, if you pick about 7 patients, only one may have pain or photophobia, or even 0. Posterior uveitis, inflammation in the back of the eye, is commonly characterized by flutters, blurred vision, Photophobia, seeing flashing lights, which I explained already. Then general symptoms, general signs and symptoms of uveitis. So these are now just signs of all sorts of uveitis that we may find. So general signs and symptoms of uveitis can include some or all of the following. So these signs and symptoms that we're about to mention, when you are screening a patient with uveitis, a patient may have some of these signs, or the patient may have just a few of these signs. So you don't have to take it like because the patient with uveitis has to present with all of these signs. No. From the signs and symptoms that we're going to discuss on general signs, maybe a patient may present with one, maybe a patient may present with two or three, but still it would be a patient of uveitis. So they may present with eye redness and irritation. Eye redness and the irritation. Eye redness will be due to inflammatory process. Then irritation will be due to damage to the retina. Then blood vision due to uh, reduced blood vision due to reduced absorption of rays due to blood vision due to a reduction of rays reaching the retina, or due to the damage to the retina. When the retina gets damaged, you find that the very few right rays will be able to reach the retina so that the vision can be interpreted. Then increased sensitivity to light, increased sensitivity light, floater spots before the eye. Aching, that is painful eye, it may be present. Sensitive to light, increased pain when eyes are exposed to light, called photophobia. This is as well damage to the retina. Then floaters, random spots in the visual field, which are already explained. So a patient with uveitis, this is just the diagram showing a patient with uveitis. You can see how it's looking like there. So let us look at the diagnosis. How do we diagnose a patient with uveitis? First of all, medical history taking. We need to take a good history so that we are able to diagnose this patient. A complete medical history and eye examination should be performed. Laboratory tests may be done to rule out infection or autoimmune disorders. So, history of having suffered from systemic conditions, bowel inflammatory conditions, like we said, uh, uveitis can be caused by a number of factors: viruses, bacteria, parasites, even systemic conditions. So all that has to be well tackled in your history, so that you tend to know what exactly could have caused the uveitis. Dilated fundus examination. This is done to rule out posterior uveitis, which presents with white spots across the retina, along with the retinitis and the vasculitis. So you need to do eye examination, and when you do the eye examination, you're going to find that the fundus will be dilated. The fundus of the eye will be dilated. So when the fundus of the eye is dilated, this points out to posterior uveitis, which comes along with the inflammation of the retina. Laboratory tests is usually used to diagnose specific underlying diseases such as the rheumatogenic tests, anti-nuclear antibody, rheumatoid factor, angiotensine converting enzyme inhibitor, and serology for infections diseases: syphilis, toxoplasmosis, tuberculosis. So we are saying the laboratory tests may be done so that we can investigate various causes that we mentioned. Like for instance, we mentioned the viruses which can be able to bring about uveitis. We also mentioned uh, of bacteria. We also mentioned of other systemic infections. So when we are taking samples to the laboratory, we just want to be sure which factors could be reliable to cause the uveitis that the patient is presenting with. Also, major histocompatibility antigen testing. This may be performed to investigate genetic susceptibility to uveitis. The most common antigen include the HLA, histocompatibility antigen B27, and the HLA. So these are genetically predisposed. These are genetically predisposed. We get them through our family tree, through the trace that we inherit from our parents. We can also do radiology. Chest X-ray may be used to show coexisting arthritis and the sarcoidosis. All these may be also predisposed or linked to uveitis. Brain and spinal MRI. Persons over age of 25 with pars planitis should have an MRI of their brain and spinal throughout multiple sclerosis. So this may only be done in special cases of pars planitis, where we are suspecting of multiple sclerosis. So you need to do the brain MRI and the spine MRI to rule out any infections which may be quite critical. Let us look at the treatment. Let us look at the treatment. Uveitis requires an urgent referral and thorough examination by ophthalmologist, along with urgent treatment to control the inflammation. So you can see that uveitis has to be treated with the urgency. If you're unable to attend to this patient, or you don't know, you don't have any idea, you can simply refer the patient to the next referral level so that the patient is helped. Uveitis is typically treated with the glucocorticoid steroids, either as topical eye drops, that is prednisolone acetate, or as oral therapy. Prior to the administration of corticosteroids, corneal ulcers must be ruled out. So we're saying uveitis can be treated with the corticosteroids, glucocorticosteroids medications, and this can either be eye droplets or can be given as oral therapy. But you may realize that in most cases, in most situations, infections which involve the eye, we like giving direct into the eye so that we increase the potency of medication. If you give it through orally, the time the medication will be reaching the eye, its potency will have been reduced by a certain percentage. Then we also need to rule out corneal ulcers before we administer these corticosteroids, because steroids have a nature of reducing immune system. Treatment continues. So apart from this, we can this is typically done using a fluorescence dye test. In addition to corticosteroids, topical cyclopegs such as atropine or homotropine may be used. Successful treatment of active uveitis will see an increase in T regulatory cell in the eye, which is likely to contribute to disease regression. So when we are saying when we are successful with our treatment. When the treatment is going on, is going well, is going on well, we are going to see that there will be successful increase of T regulatory cells, which will be able to direct the presence of T cells in the thymus, therefore including the immune system, thereby maintaining the integrity of the middle layer of the eye. In some cases, an injection of posterior subdural triminosolone acetate may also be given to reduce the swelling of the eye. So this one, it's more like an anti-inflammatory drug. So it will be given so that the swelling of the eye comes down. We can also give some antimetabolites. Medication such as methotrexate is often used for more aggressive cases of uveitis. Methotrexate, which is anti-cancer drug, or one of the cytotoxic drugs that can also be used in cases which it's quite severe. Then anti-diabetic drug metformin is reported to inhibit the process that causes the inflammation in the uveitis. So metformin has been reported to be useful in this condition as it stops the inflammatory process of the middle layer of the eye, which we call it as the uveitis. If iritis is mild, treatment may involve dark glasses. If iritis is mild, treatment may involve dark glasses so that you reduce sunrise and thereby reducing eye irritation as the patient has photophobia. Then eye drops that direct the pupil to relieve pain may be given. Eye drops that direct the pupil to relieve pain may be given to control pain. Then steroid eye drops, which I've already mentioned, such as prednisolone. Pars planitis is often treated with steroids eye drops. Other medicine, including steroids taken by mouth, may be prescribed to help suppress the autoimmune system. So if there is autoimmune system, this autoimmune system is not the immune system that is only restricted to the eye, but autoimmune system is affecting the entire body. So you need to be prescribed the steroids which have to be taken by orally so that the entire body can benefit. In doing so, the immune system of the patient will be raised. Posterior uveitis treatment depends on the underlying cause, but almost always includes steroids taken by mouth. The reason is what I've explained already. Additional specialists in infection diseases or autoimmune may be needed for such diseases as syphilitic, tuberculosis, or AIDS. So there are other conditions in which we know that they are very good at reducing the immune system in conditions like AIDS, tuberculosis, and the syphilis. So in this condition, there may be need for us to involve the specialists who have specialized in the treatment of this condition so that they advise from the medical point of view. If the uveitis is caused by a body-wide infection, treatment may involve antibiotics and powerful anti-inflammatory medicine such as corticosteroids, which we mentioned already. With proper treatment, most attacks of anterior uveitis go away in a few days to weeks. However, relapses are common, like I mentioned earlier on. Say it can either be a single treatment or reoccurring or chronic. Inflammation related to posterior uveitis may last from months to years and may cause permanent visual damage even with the treatment. So inflammatory condition related to posterior uveitis, which is not common, may last months to years and may cause permanent visual damage even when someone is on medication. And this also explains as to why the patient with uveitis has to be treated as with a matter of urgency. The prognosis is generally good for those who receive prompt diagnosis and treatment, but serious complications include cataract, glaucoma, macular edema, and permanent vision loss may result if left untreated. So like I said, the earlier you get diagnosed, the better. If you delay, the consequences may be quite severe. Prognosis varies according to the type of uveitis, the severity, duration, and the responsiveness to treatment or any associated illness. This has been mentioned. So complications of uveitis include cataract, which is clouding of the lens, then fluids within the retina due to damage that has taken place in the retina. Also, glaucoma will come as a complication because the constriction, the dilatation of the pupil brings about blockage to the flow of intraocular it blocks the flow of aqueous humor, raising the intraocular pressure. Then retinal detachment due to damage to the middle layers, then permanently damage the vision or less vision due to damage to most delicate structures of the eye. How can we prevent uveitis? Periodic eye exams every 2 to 3 years for health patients under 50 years. Under 50 years. For patients over 50 or those with known health risk factors, eat a nutritious diet for eyesight. So one way of preventing uveitis is to ensure that you go for eye checkup once in a while, maybe once in 2 years or once in 3 years. Then those who are above 50 years, one of the preventive measures is that you eat nutritious diet for eyesight, and we know the diet that contains high content of vitamin A. Among them, it's carrots and purple or papaya. Wear durable eye protection when involved in activities that could cause traumatic. So if you know that you deal yourself in activities that can injure your eye, like welding, wear protective glasses to prevent any trauma to the eye. Like you saw that under the causes, we also mentioned trauma to the eye as one of the causes of uveitis. If you are a carpenter, you know that those planks, pieces of planks, at some point they can injure your eye. They can act like foreign bodies to your eye. Better you put on something to protect your eyes. So we have come to the end of our day's discussion under uveitis. Unless you have some questions that needs to be answered. If not, I have to thank you so much for the attention that you had during our discussion. Thank you so much.